What if I told you that a mother's milk is more unique than her fingerprint? Bridgewater College will welcome Dr. Katie Hinde, Associate Professor in the Center for Evolution and Medicine at Arizona State University, for an endowed lecture on Thursday, October 23rd at 7:30 p.m. Her lecture is titled The Milk of Human Kindness and will talk about history and conflict regarding infant feeding. According to the Arizona State University website, Hinde investigates the food, medicine, and signal of mother's milk and has worked on several peer-reviewed journal articles and book chapters. She has co-edited a book and runs a blog called Mammals Suck Milk. Hinde says that she is a biological anthropologist who's interested in human adaptation, specifically breast milk's role.
I'm particularly interested in infant development and maternal health during lactation and the way in which mother's milk can shape all sorts of aspects of infant development.
Hinde says that breast milk is so much more than nutrients for a baby.
It's really important for immunity for developing babies because some of them are still too young to be vaccinated.
According to Hinde, milk is medicine for babies.
Mother's milk protects them from a lot of pathogens in that early naive place. And it also helps train their immune systems. And this is, milk is medicine in that sense.
Hinde adds that mother's milk cannot be exactly replicated with formula.
That you can artificially replicate that with food science is insufficient, right? You can't replace everything that mother's milk is with an artificial formula.
According to the TED Talk speakers page, Hinde's work has been highlighted for tackling social justice in health and research. Her work has been featured in The New York Times, National Geographic, Wall Street Journal, and more. Hinde says that her research challenges policies and fights for proper access to postpartum care for mothers.
Presenting those findings among other expert academics, but then also working to bring that knowledge into policymakers' domains, into healthcare delivery, into the general public and family decision-making.
Hinde states that mothers in the United States are not treated fairly postpartum.
By not having policy, like federal and state level policies that protect mom's time to bond with babies, to support that lactation establishment, then we're really underserving mothers.
According to Hinde, there is a lack of policies to support mothers being able to breastfeed, which can impact their health.
There's a huge health impact on moms. So the total number of months a woman spends breastfeeding in her, adulthood is going to have an effect on her risk for breast cancer and other reproductive cancers. It's going to have an effect on their metabolic health and their risk for type 2 diabetes.
Hinde says that she was previously connected with Dr. Tamara Johnston-Yellen, Associate Professor of Biology and Environmental Science and temporary endowed lecture chair at Bridgewater College through March Mammal Madness.
Tamara has, been a really engaged colleague in this sort of science engagement, getting people excited about science. Kind of, it's basically, it takes the basketball March Madness idea and then makes a bracket of animals.
Johnston-Yellen says that she is interested in hearing Hinde talk about her research on human mammals.
I think it's fascinating to see both the evolutionary history of it and the social context of it as well. And so I'm looking forward to hearing her speak on the global health aspect of lactation.
Hinde says that she's done this endowed lecture before, but she's going to present it in a new way this time.
And it's the first time I've been invited to talk specifically about lactation and breastfeeding within that social justice framework, right? So that is the invited lecture series that I'm being brought out for. And I always embed that like thread in my work because I care about our community health.
Johnston-Yellen says that Hinde's work plays an important role in social justice postpartum.
There's a lot of stigma about nursing in public, what's best for the child, what's best for the parents, and having some support system that helps parents make the decision that's best for them and their child.
This is Jeffrey Prevost for BC Voice.